So I'm a spine surgeon. I'm an orthopedic spine surgeon, 5 years into practice. My interest in spine surgery developed as a medical student, watching scoliosis surgery in children. And very early on in medical school, I was very confident this was the only thing I wanted to do. In medical school, I was very lucky to have strong mentorship with scoliosis surgeons and complex spine surgeons. I had the opportunity to go abroad in Africa, in Colombia, Mexico, and other countries to really treat patients in a volunteer setting with very severe pathology. In addition, I have an academic background, having been at a university for a couple of years. I value teaching and I value educating my patients. I also think it's important that spine surgery as a specialty be adherent to the surgical principles and the scientific literature. So everything I will tell you in clinic is based off of my personal experience or scientific fact. I did my education as an undergrad at Cornell University, and I trained in engineering. After that, near the end of my undergrad, I decided that I wanted to become a surgeon, although I wasn't sure what kind. I got a master's degree in biology at NYU, and during that time I also did an extensive amount of research, and then eventually went to NYU for medical school. In medical school, I became very passionate about scoliosis and complex surgery, both adult and pediatric surgery, and then eventually went to Thomas Jefferson University, or the Rothman Institute in Philadelphia, for residency. During that time, I did an extensive amount of spine surgery as a resident and did a lot of research as well. I was even awarded several research prizes during that time, and I believe graduated as the most published resident of all time. I went on to do a fellowship at the University of California in San Francisco, which is an adult and pediatric spine fellowship, where I really focused my attention on learning complex spine techniques, in addition to minimally invasive techniques. After that time, I went to the University of Washington in Seattle for 2 years, where I was a professor and had the privilege of taking care of very complex pathology while also teaching residents and fellows. Shortly after that time, I decided I wanted to relocate to Southern California, which has always been a long-time interest of mine. I chose this area because it is particularly underserved, and there's a large tertiary referral center hospital in the region. So patients often ask me how I decided to start my own practice. I think it came over a process of several years. Initially, I was with a university setting, and I saw the advantages of being in that setting. After 2 years in a university setting, I decided to join a group private practice because I like the personalized touch of private practice. But I found that it was very hard to control a lot of the different aspects of the practice when you're in a group. It's largely unfocused. It doesn't offer you the same concierge level care. And I found I was often distracted by other aspects of the practice that weren't focused on spine. When I started my own practice, I found that all of my energy could be focused on clinic, patient care, and spine surgery, which over time I think has allowed all of us to work together as a team to really provide the highest level of care. So patients always want to know about their surgeon. I met my wife in residency, the first week of residency, and we were very fortunate that we were friends first and then got together a year later. After the 4 years of residency, we got engaged and got married, and we both went to fellowship together in San Francisco, and then we both moved to Seattle together, and we both decided to move to Los Angeles together. She's a dermatologist in Long Beach, so if you ever ask me for a dermatology referral, I'm very biased. And I have 2 children. Clara was born in 2017 in Seattle, and Devin was born during the pandemic in 2020. I'm very grateful to have 2 healthy, happy children. People ask me what I like to do in my free time. I like to do a little bit of everything. I'm very much into fitness and exercise. I like to run on the beach or surf or cycle. In addition, I am an avid concert goer, and also I like to really carve out time for my family, especially on the weekends. I've also bought a truck, and I have a camper on the back, and I'm taking my kids camping every opportunity I get over the next few years.